Good morning to you all our viewers once again. You are welcome to Schools Are Closed, but it is not a holiday. An intervention of Savannah Signatures and Educans International. The aim of this program, since we started about 3 or 4 months ago, is to ensure that first and foremost, every school-going child out there goes back to school when schools reopen, be it within this COVID-19 period or after. We just want to ensure that every child out there gets back to the classroom. One other very important aspect of this program is to offer psychosocial support to individuals, to all of us, to children, to parents, to teachers, these three people especially, as also within these COVID-19 limitations that we find ourselves in. I mentioned three individuals: students, school-going children, I mentioned parents, and I mentioned teachers. I know we will all fall under, any of these categories. So once again, we are coming to you this morning. My name is MFR as usual. I don't know if you know this. So Saturday, 10th of October 2020 is World Mental Health Day. Yes, mental health. We've done a couple of streamings on mental health, programs on mental health, but now we don't necessarily need this celebration to talk about it. That's why we've been doing this for this long. But this celebration, worldwide commemoration of this day, gives us the opportunity as as a part of this universe or world, to really center on what mental health is, to look at what Ghana as a country is doing when it comes to mental health. To start off with the conversation, let me just do this quick definition of what health is before I introduce to you our guest in the studio. So the World Health Organization defines health as a complete physical, mental, and social well-being of an individual. Let's take that again. A complete physical here, mental, and then social well-being of an individual, and not merely the absence of disease or infirmity. So it is a whole package. It is a salad of everything. The minute you have one out, it means that there is a problem.
Exactly.
And today we want to tackle mental health, because as we've been talking about in our previous conversations, it is that dark patch in our health system that we barely talk about unless there are challenges or problems. I mean, serious problems coming up. In the studio with me once again is our usual honorable man here. His name is Mr. Peter Mintir Amadou. He's a psychologist from Tolek, Ghana. I know you know him because he's been with us a couple of times. So Doc, Mr. Peter, you're welcome once again to Sign TV.
Thank you for having me.
Okay, sir. Before we delve, so let me briefly also say that today's program will be in two parts. We will have Doc here, Mr. Peter here, first telling us a bit about what Tolek. I've been saying Tolek for a number of times now and in the past. We want to really understand what Tolek GH is all about, and then the second part we will delve into our issues of mental health proper. In the second part we will have another guest join us. He's also a psychologist. Throughout these 3 days, Okay, so our plan for this celebration is to have a 3-day crusade. You should have seen the flyer around. If you haven't, go on Savannah Signatures, go on Tolek GH on Facebook, go on Southside TV on Facebook, you will see it. A 3-day crusade just to get us understand what mental health is all about. But now it is the turn of Tolek GH. Mr. Amadou,
yes,
tell us, please, who is Tolek GH?
Thank you very much. Good morning to your cherished viewers and listeners, and thank you, Savannah Signatures, for having us on your platform, Southside TV. Yes, Tolek GH is an acronym that stands for Total Life Enhancement Center, Ghana, an organization that is advocating for mental health. And our strength is in the area of psychological interventions. Mental health can be in two forms. We have a medicinal part, and then we have the non-medicinal part. We are into the area where medicine most of the time is not available. Then why do you have to wait for people to get to the point of looking for the medicine? And that was how Tolek, as an organization, was formed to provide psychological services as well as link individuals. Sometimes you may be an organization, but you don't have all the expertise. But by virtue of taking an interest in that particular aspect of life, you may know some individuals who have expertise. So we link individuals to organizations that are providing mental health services and also helping other individuals in the area of mental health in general. So our efforts are aimed at supporting SDG 3, who talks about good health and well-being, ensuring a healthy life and promote well-being for all at all ages. That's what the SDG 3 talks about, and that's what Tolek GH stands to do. Our focus is to enhance the psychological interventions in mental health healthcare delivery system, because psychologists are a group of professionals that are readily not available in Ghana. And we thought if we are able to help, the individuals who need help can get some of this support from our area, or we can refer them to other places where the services are available. And we also anchored around what is termed the biopsychosocial model of health delivery, because we understand but bacteria can bring disease or infirmity. Beyond that, the psyche of the individual, the social environment of the individual have a role to play in the disease situation that we find ourselves. And that is what we believe, that biologically the medicine is good, but beyond medicine, there's also psychology, there's also social determinants of health, which we need to look at and encourage people to appreciate and to look at them. So this is about Tolek, and we've been in the existence, let me say, for the past 3-4 years. And I would say 5 years in as a let's say a hobby, something we're just doing for the purpose of being in the health sector. But later on, I thought there was a need to probably formalize it and let people recognize and appreciate what we do in society.
Excellent, excellent. Now I understand why Savannah Signatures has decided to partner with you on all of these our interventions around psychosocial. You talked about the fact that we lack clinical psychologists in Ghana, and it is I don't know if appalling is the word to use, but it's a sad thing.
Very, very sad.
Someone would say it's a sad thing. It's really sad looking at the situation. I mean, when you walk even through Tamale and you see all of these people that you think that need that kind of help, and it's even with them, you see and you understand that that's even the latter part of the situation. There are a lot of us, even within this room, this studio that we're talking about, that have some form of mental, how do you call it?
No, instability.
Yes, or problem. It doesn't mean you're mad. I mean, so Thank you so much, Tolek GH. I would love to briefly talk about your target population.
Yes.
Who do you serve?
Yes. So Tolek GH, the greater population that we're looking at are the youth. Why are we targeting youth? All definitions of youth and all people talking about youth say they are the future leaders. And if the youth today, as we know it, are involved in substance use, the addiction of its-related issues, are involved in risky behaviors, are involved in truancy as it comes to education, do we have future? And that is why Tolek thought that there's a need. And if you also look at it, the youth are a group of organized group of individuals. Basically, they are found in schools and sometimes found in places where you can easily read them. So that we target this individual to help them improve on mental health literacy and through them serve as ambassadors to their homes, to the churches and to the mosques, so that a lot more can come to appreciate what mental health is and what we do. But we also target health workers. You know, the greater part of the challenge has to even do with health workers. Because if you have a health worker who doesn't understand what mental health is, or who doesn't appreciate what mental health is, the system is going to be challenged quickly. So the purpose is to have a well-informed health worker who can be a benefit to the patient that come. Not every patient that goes to the hospital will need medication. But if you have an informed health worker about mental health, they will be able to direct or refer this patient appropriately.
I guess that also impacts even health worker-patient relationship.
Perfect.
So that you go to the hospital and you don't find nurses or midwives or community health nurses who are just screaming and shouting at people.
Exactly.
That is really, that is understandable.
Yes.
We all need, to focus
to be mentally stable.
On this, to be mentally stable in order to live healthy lives, fulfilled lives. Mr. Peter, unfortunately I have to wrap up.
Yes.
I know I will have you throughout these 3 days. Yes. So as and when I have you, I think tomorrow, we will continue with the question with more on Tolek Ghana. But briefly, if anyone wants to contact you, because yes, this partnership means that we're making you, and you are also making yourself available to people out there.
Exactly.
So please, if they need to contact you, we know your first point of call is the She Plus call center.
Exactly.
Yeah, but apart from that, where do we find you?
It's Tolek GH is located on the Naluru Estate. Plot number 123, just adjacent Right to Play Northern Regional Program Office, and we're in the same building with SGS Ghana. Okay. So if you come in there, you'll find us. I can also leave a number behind, people can call. But as you mentioned, the She Plus platform is a place where when you call, surely Tolek can be reached. If what you call and you're looking for has to do with psychological support, they will reach us and be available. But the contact is 0242 15 4006.
Thank you.
0242 15 4006.
Are you visible on social media?
Exactly.
Please.
Yes. On social media, we are Tolek 17 is our Facebook page. Tolek 17, TOLEC 17. I mean, that's a Facebook page. 17
as in 17 or words?
17. Yes.
TOLEC 17 on
Facebook. And then Instagram and Twitter, Tolek 13. 13.
Okay.
Yes. But before I leave, I want to say that as an organization, we are glad to announce that we are, as people say, the premier organization as it comes to private institutions.
Yes.
Offered the opportunity to, or accredited to provide psychological services in the whole of the North.
Yeah.
We have been accredited by the Ghana Psychology Council to provide psychological services.
Yeah. So it means they have the backing of Ghana to provide services to us. Okay.
So that is what Tolek stands for, and we want to make sure that we want to do legal things. We don't want to be doing illegal things.
Exactly.
Therefore, when we thought that there was a need to provide psychological services, we still went ahead to get the backing of the Ghana Psychology Council to give us the accreditation to provide services in Northern region.
Thank you so much,
Thank you.
Mr. Peter. So briefly, this is what we have on Tole Ghana. Yes, I'll go through their contacts once again, but now we will take a quick round. I will just get out for a second and come back. That's what I mean. Let me just put it plainly like that. So yes, give me a second. I need to powder my face and do something and be back. We'll come back with our guest to discuss this year's Mental Health Day. Thank you very much.
Thank you.
So this second part of our program, we're going to talk about self-care practices. When I saw this topic, I wondered what they meant by self-care, and I do understand that by now you two are wondering what self-care is all about. Self-care in mental health, let me say. And in the studio to discuss that with us this morning is a new face. His name is Mr. Daniel Aqua. He is a clinical health psychologist. Like we said, throughout these 3 days of crusading, we're going to have psychologists in the studios with us. Yes, we know Ghana lacks the numbers when it comes to clinical psychology. So when we have the opportunity of engaging some of them, the limited few, I mean, we should take absolute advantage of it. So, Mr. Aqua, you are so very welcome to Sapsign TV.
Thank you very much.
So we'll just, like I always say, we'll just dive into it. We're not wasting time because we don't even have that much time. When we talk about self-care in mental health, could you just broaden our horizon on that?
Thank you again, and I think it's a good morning.
Yes.
When we do talk about self-care, it's all about taking care of yourself.
Okay.
Just the layman's understanding.
Okay.
And as to how you take care of yourself, you yourself might know better. Whether what you're doing is actually promoting you or is actually bringing you down.
Okay.
You would say that you may be employing effective ways or non-effective ways.
Okay.
So we're just looking at the things that individuals, to the processes that they go through to improve their health. And health here, I think you've already defined health.
Yes.
And mental health is an aspect, and well-being is an aspect of health also.
Yeah.
So improving and maintaining your health in relation to both physical and mental health.
Yeah.
What do you do to strengthen yourself physically? What do you do to strengthen yourself mentally also? So if the individual has put in place mechanism or actions that he or she will engage in day out to make sure that he doesn't even fall to the end of the spectrum, that someone will say, hey, look at him going, look at her going, then we can say that, oh, the person may be employing effective self-care practice. So it helps us to maintain the balance so that we don't even go to the end of the spectrum. And even if the challenges present itself, what do we do to make sure that we are brought back to a more homeostatic or middle point of view?
That's so a that big word.
A balance, middle point of view, middle point of view, so that we don't even veer down. And it's supposed to be actions that help us to refuel, and not things that we engage in. Then afterwards we go and sit in our house and we begin to think, hey, this thing I did, and look at the amount that I've spent. Meaning that you yourself, you engage in the fact that afterwards you get talking about it. So it's supposed to be actions that help you to refuel and not actually bring yourself down. So what are you doing to maintain your physical health? What are you doing to maintain your mental health?
Thank you so much. So what are you doing, you out there, in maintaining your physical and mental health, as well as social, right?
Mental health, the definition of mental health, it cuts across.
It cuts across all of these. Thank you so much. So, Mr. Aqua, what are some of the things to consider when we talk about self-care? And I want to also go into the basis of self-care practices.
Okay. Self-care is not a quick fix. When we look at the various aspects, we can say something like physical area. So when you ask someone, do you exercise? The person will tell you that, oh, okay, yes, I do exercise. Ask the number of times the individual exercises, maybe 4 times a year. And the person will think that he's exercising.
Maybe we should now tweak the way we ask the question. No, please go on.
So it's not an off thing. It's supposed to be habit. It's not something that we just rush to, then afterwards we close the chapter. No, that is not it. It's supposed to be routinely planned,
religious thing.
And day in, day out. And the basis of the rationale is, if you are not healthy, you can't help someone else. It is when you are fully fit, that is when someone seeks for help, you'll be able to provide the needed advice, the needed financial support, the needed spiritual support. But if you continue to exhaust all these your resources, when someone comes, you dash out, with the notion that if I don't give out, I'm being selfish, and you continue to put yourself at the disadvantage. You get to a time that when, quote unquote, someone actually needs you, you might not be able to be in the position.
You can't give what you don't have.
Yes. So the basis is, man, know thyself, help yourself first before you will be able to help someone else. But unfortunately, self-care seems to be one of the areas that we quickly sacrifice when things get dire. So if we see someone exercising or going for jogging, we think that, oh, this individual has lots of time, but I don't have the time. When problem comes, that is when we begin to sacrifice our leisure time, we sacrifice our sleep. Eating becomes a problem, and the things that actually are supposed to help stabilize you, that is what you keep sacrificing, with the notion that you are engaging in some frugality. You are just, this is not something I need at this moment, but at that moment this is something you actually need, but if something is more bigger, so you need to attend to that person. But in that case, no, you are just shooting yourself in the foot. So you yourself, it is when you are fully fit, you can help yourself and help others also.
Thank you so much. So what I'm taking from that part of the conversation is, again, if you're not sound yourself, if you're not mentally sound yourself, it will be difficult for you to deal with the other things that go on around you. And like we summarize, you cannot give what you do not have. So taking care of the self is crucial.
To helping someone else. Thank
you so much, Mr. Akwa. Now, how do I care for this self? I think for me myself, I've had a couple of challenges. As you were talking, I started seeing myself in some of the scenarios you were creating there. You let yourself go for so long, and then just at some point in time you just realize that, okay, no, so this is not how it's supposed to go, because you feel that you're taking a downward turn or in something like that, and then now you start sacrificing certain very important things in your life just to come back on track. How do I take care of the self?
Taking care of yourself means that you yourself know yourself. Despite the tenets of self-care or the areas of self-care being somehow rigid, and when we say somehow they have been categorized, you won't look at what someone else is doing to say that, oh, okay, because this is working for this individual, if I also engage in, no. If someone goes for jogging maybe in the morning, 7 a.m., and you know that your work starts at 7, you can't. You can't also. So the first point is you yourself knowing yourself, knowing your schedule, knowing what works for you and what doesn't work for you. So then you begin to look at the various areas of self-care, and the various areas we can have psychological, we can have something like social, we can have something like financial. Financial also. Because funny enough, as your definition said, when it comes to mental health and health in its larger concept, these areas are however related, somehow related. For example, if your account is 0.00 and you know that tomorrow, what am I going to eat? There's a possibility that you begin to think about what is going to happen tomorrow. Your sleep might be disrupted. If you don't have adequate sleep, you begin to wake up with unnecessary headaches. When these headaches come, you begin to worry, and anxiety is also setting in. So the financial aspect has translated into you not having good sleep, and because of that you woke up with physical condition, which is headache. So all these areas, we can say that they are on their own. They are very, very much related. And spiritual, professional also. You have to consider all these things, because in mental health and in psychology, spirituality has been identified as one of the areas that buffers the stresses that individuals go in, and it is easy for someone to sacrifice for a higher transcendental power, and we do that a lot. forming me to it, give it to God. So when we go through stresses, we are able to just leave it out like that, and we don't hold it to the emotional connotation. So please consider these areas: physical, and the physical nutrition. What we inundated with literature, the connection between the food we eat and our mental health. And even with this classical example, you can eat some food and after you become down.
Yes, in this office, I know someone who eats bamboo in the afternoon and then they are messed up.
So this even just the phase that our nutritionists have identified the connection between the food we eat and actually our mental health.
Okay.
So nutrition affects you physically, it affects you mentally also. We don't like going for routine checkups, and we can ask all of us in this studio.
No, me, I don't remember
the number of times that we do go for physical.
I don't think I just get up and even.
We are doing it on an ad hoc basis, as and when. But as I said, self-care is not as and when basis. It is something that we strictly put in place day in, day out, or week in, week out. So in the area of physical, these are some of the things. Exercising also. Emotional, are you the individual that when going through troubles, the person is unable to come out and attend to these emotional troubles? Rather go to the room, lie on the pillow and sleep. After in the morning, polishes the face, comes out, hey, I see everything. In the evening goes back and start crying emotionally. If you are not doing well, how are you able to stabilize yourself? What are the things that you have put in place? I've already talked about spiritual, financial. The month ends, 5 days later, you are looking for loan. And this is the rat race. It keeps on recycling. Each month in, month out. What are the stringent measures that we've put in place to make sure that we don't actually let ourselves go to downward spiral also? Then psychological. Unfortunately, this part of our world, and I wanted to start with that. When we talk about mental health, we seem to have, in a fun way, been able to associate mental health to mental illness.
Crazy people.
And in Ghana, whenever mental illness comes in also, we have the non-medical term that society has been able to coin, which is madness. And I don't know where that definition applies to now, because
maybe it's because we do not understand.
That is it. So medically there's nothing like madness. So when we talk about mental health, automatically people might go to mental illness, and mental illness, madness. Meanwhile, mental health is different from mental illness on its own. So it is no way that strongly cause and effect. No. So when someone is even going through little problems and supposed to go and visit a professional, the person will be like, oh, when I go, they will think that I am mad. That is it. That's the association. So we don't seek mental health. So psychologically, do you seek the help of professional people? Are you that hard on yourself that always you look at the things that you've not achieved, rather than the things that
you have achieved?
You
are blessed with.
You look at, and I always tell people, look at where you are coming from and look at where you are now, and you see that, oh, okay, Charlie, you will have some gratitude, and being grateful also helps a lot. So. It cuts across knowing yourself in these areas and the things that you know that you are not doing right.
Thank you so much, Mr. Aqua. I mean, this is enlightening. It's yes, like you said, mental illnesses around here, growing up everywhere, it has been synonymous to
madness.
Yes, madness. So even saying that someone is depressed is a problem. No one will want to say that they are depressed, because then someone means that they have some problem up there and they may not be behaving normally. This is the essence why we're doing this, just to inform us, just to educate us, all of us, you watching us also, on what mental health is. There are so many aspects of mental health, and maybe we should just delve into the aspects now. let's talk about the aspects and also center on this care plan and how to create it to just to suit everything you've said now. Okay. That it's supposed to be a conscious thing, a conscious effort that we do every minute, every second of our lives. So how do we create this plan? How do we go about living it also? I think for some of us, yeah, we do the plan, but then next minute you know that you've passed elsewhere. So what is the plan? How do we create it? And maybe also, how do we ensure that we're sticking by the plan?
Okay. As I said, it's individually specific, and also behavior, learning new habits is progressional. Okay. You have to progress from one stage or the other. Yes. So one way for us not to get to the middle and let go is to start small. Okay. If you don't have a routine self-care plan, there is no need practically sticking to a 1 month and 1 month each day you've inundated your day. You're already stress schedule and you are trying to think that this is supposed to work. No. Start with something small. Okay. Then as you go on, you progress. Okay. And because it is conscious also, and because it might not be habits that we are that much used to, we are supposed to get reminders. Yeah. And the reminders, it could be now, there are various ways of setting up notifications on our smartphones. Yeah. We have some friends who can keep us constant reminders also. And then also, at least we should see this some form of personal achievements that, I instituted this and I was able, with the notion that this is not putting additional stress on you. It is rather supposed to reduce whatever form of stress that you've been going through. So if it is actually increasing, that means that there is a question mark in the plan that you are actually instituting. So if you are able to take these factors into place, then developing a self-care plan can be very effective. And as you said, how do we maintain it? It will be very easy for us to maintain. But then also, if you can take a pen and paper, you just do 3 areas. You look at the area of self-care that you think that you need to institute. Okay. Then you look at the current practices that you think that is not helping you.
Oh, okay.
So
what you need and what you already have, but it's not helping you.
So the areas of let's take for example physical.
Yeah.
Okay.
I wish I had a board here to just let's
physical. So for example, area of physical physics, being physical, you look at the current practices. Are you the one that if you feel sad you begin to eat for the whole country? Or are you the one that when you get your
Mr. Abba, it's like you are talking about me.
Oh, why would I look at it? Are you the one that when the month ends, you take your salary, you go get all the alcohol, you get all and within 2 weeks, the money is
and you're looking
finished.
for money.
So yes, you look at the current practices that are not actually helping you, then you begin to look at alternative practices. Okay, is it possible that if I cut this area, it is going to help me a lot? And if it's something that you easily identify with, when you achieve it, it gives you that gratification. You feel okay, which I do some. Do you get it?
Yeah.
Okay.
Yeah.
So you take, then when you look at the emotional areas also, engage in positive and rewarding activities, not activities that you engage in later on regret. And it has been, people say that had it not been for you, this is where I would have been. That means that the individual sacrificed him or herself without even having some form of achievement. Yeah. So even the individual has identified that, my sacrifices is something that I did for someone. It's supposed to be somehow rewarding. Okay, so if we are able to engage in emotionally rewarding activities, it can also help us. So in the emotional area, you look at what you are doing. Is it that you easily get angry? Okay, and when you get angry, Anger is not just a social term. It is physical and it is biological.
Yeah, what do you do? I know someone who just throws anything at all they find around them when they are angry.
It's not physically healthy for you. It's not physically healthy for you. So you look at the things that are not helping in that area, then alternative practices. No, okay, there are form of relaxations that you need to, we have something like count 1, 2, 3, breathe in, breathe out. Give you some downtime for you to think through, for you to calm down. So there are alternative ways of emotionally managing whatever. Then spiritual. Also, as I said, what have you been doing that you yourself already eat the least you think that someone is doing you? Because you are not engaging in anything for you to feel that spiritually connected, and you begin to unnecessarily worry about life challenges. So what are you doing currently that you think that is not helping you? Alternatively, what can we do that can actually help us? If the person feels that, okay, now I have to increase the rate at which I go to church, why not? If the person, I have to increase my prayer, why not? Reading spiritual books, connection with nature. Go to the green areas, go to the sea, appreciate the sea. So things that we do to improve.
I like to take a walk, especially in the evening.
That's good.
Yeah.
Also. Yeah. So you look at, and we have the financial, professional also. You yourself, you are in the house, you have problems, you come to work, you are having problems with your colleagues also. Where do you get your peace? So it's like you're from one hell to another hell.
Yeah.
So what are the things that we might not be doing right, or what might not be helping us? You put it down, okay, if these are the things that are not helping me, what are the alternatives that I think that if you feel that your resources are that depleted and you can't get any alternative, that's why professionals are there to help you through some of these things also. Then, as I said, psychological also. Let's seek the help. Please, those who work in the hospital, they are not planted by the devil, and it's not like you are going to consult any. It is a science that we are using to work with, this cooperation that we are using. So if you are able to put these things down, see, then you begin to look at the time. Okay, within a week, if I look at my schedule, I can implement this for maybe 2 to 3 times in the week. As you go on, you begin to progress, and you see that you are getting more comfortable with some of these things. It is easier for you to add on until it becomes a habit. With repetition, behavior becomes a habit.
Okay. Thank you so much, Mr. Aqua. I'll take your last words. I would want you to say something brief on I would want you to say something brief on this year's celebration, and then just narrow it down to COVID-19 and its implications on our mental health. Okay. We've been doing a couple of series over this 4 months period, and a lot of issues are coming up. We've learned that suicide is one critical issue. Children find themselves, children especially, girls, women also, find themselves in homes, and there's so much abuse, there's so much violence, but they cannot run away from it because of these limitations that COVID-19 has brought in its way. I just want for us, let's just focus on the celebration, on the theme for the celebration, and then a last word to anybody out there who is going through anything. We said that you don't need to start experiencing anything negative in order to start taking care of your mental health. But we now want to respond, send a hand out there to especially the children, the youth that Mr. Amadou talked about, who may be going through something and, like you said, do not have any avenue for redress. They don't know where to go to talk. So they enter their rooms, they cry, they come out, they just clean it, and you seem like everything. Just a word to them. Okay. Let's throw some light out there for them to help them walk. Yes.
Your area has touched on about 3 weeks seminar, but you try our best.
Yeah, now we have to do that in about 5 minutes.
Yes, you have to do that in a very short. I think when it comes to World Mental Health Day, we try to throw more light on salient areas that we need the general public need to pay more attention, be it at policy level or at individual level. We all have role to play, and that's why some of us are here to educate or help with the education area. Mental health or mental illness is not it's not a taboo. We all, in one way or the other, our mental health will be challenged. So far as we are normal human beings, it doesn't mean that you're mentally ill. And if you feel that, okay, where you've gotten, you might need some boost, why not? You seek for the proper avenue, especially during this COVID-19 times where physically and emotionally every area has been stretched. When you talked about the abuse, I thought it was only foreign related, because that's what the literature was saying.
Oh no.
That the rate of abuse increased during the COVID-19. Then there was a research in Ghana here which brought likewise that we also face similar problem. And you'll be like, people have been avoiding themselves that much, or now that they've been placed in a controlled area, you'll be having the challenge. So COVID-19 also brought in the challenge of people sticking with each other and human behavior. If you don't take a crisis or conflict might result, maybe that might have resulted in the increased number of abuse cases. Yes, but parents should know that whatever they do, they have an implication on the children that are in the house. They are not just that, they learn. And how, in matter of problems, how you are able to cope with it might be a resource for your child, because growing up, maybe he knew that when daddy was angry, he picks the belt. When he goes out, there's a possibility that when he's angry, he might also pick the belt. So parents should know that whatever goes, so we know it is challenging, but they are adults and they can handle it better than what they expect a child to handle.
I don't want to cut, but with that example goes another one. Then the mother in the home who also sits down and receives slaps from her husband without doing anything about it. When you have a girl child in your house, then she also grows up learning that a man hitting a woman, there's nothing wrong, so it's acceptable. So you sit, even when you're getting beaten and you feel like killing yourself, yes, you should still sit through it. Please go on.
Okay, so that one too is an option, because let's emphasize that children learn. They are active learners in the house. So parents should be careful also, and we should also try find a way of giving these children voices. We should listen to them more and not like they don't know what they are talking about. They might not be able to communicate it in such a way that we may be, but if we take actual good care, we may see that there is some specific content in what they are saying, and let us not just throw it away like that. So the parents have a role to play also, and we will still stress on seeking for professional help when they need be. Mental health, again, is not a taboo.
Yes. Thank you so much, Mr. Daniel Akwa, who is a clinical health psychologist. Yes, today is day one, and we've talked about self-care practices for these past 40 minutes or so. Before I leave, there is one very important thing here. We have a comment from, I think Ayamba is a man, Ayamba Oting, on our Facebook. He says that he's a young man with a lot of psychological issues. I think he developed these issues whilst growing up with foster parents. This issue again. I want to see a psychologist, but the health facility in my locality only has a psychiatric nurse. Can I still go and see him, though I don't have any psychiatric issues as perceived by society? What will you say about that?
Definition for, so like the difference between our practice and that of psychiatry is most psychiatry would tackle it with medication and some form of psychosocial support. We don't deal with medication. Yes, we do with medication. And there are some conditions that wouldn't come to us because we know that the person has lost touch with reality. In that case, when you are talking to the individual, the person might not be able to even grasp it. So then we will refer to the psychiatrist to bring some balance before we but the individual thinking that his might not be psychiatry related. Psychiatry, they don't, if there is no psychologist in that area, if you go and they know that your condition doesn't demand for medication, they are not going to give you medication. They may have avenues for referral, also able to do some 1 or 2 counseling to help at least stabilize you. So he shouldn't think that going to the psychiatry is more of the psychotic symptoms that he may be thinking, delusion, hallucinations, etc.
Okay, so now Mr. Danielka is going into the specialized words and the delusions and then all those things that are coming through. So basically what he is saying is that you can still access that facility. When you get there, the psychiatric nurse will do the evaluation. If you do not need medication, there's no way they will give you any medication. If she feels or he feels that they need to refer you to a higher authority to take care of you, they will do that. But the essence is that you need that help, so just go there first. That's the first point of call, and then they will diagnose and then move you ahead through the care continuum. Please, it is essential. Go, they will take care of you. If you don't need medication, they will not. Mr. Akwa, thank you so much for joining us this morning. Thank you so much, Mr. Minti Amadou, for being here to tell us about Tolek GH. So for all of you who need help, we are going to publish some contacts from these resource people, these specialists that we've had in the studio today for you to get help. But in the meantime, if you need urgent help, before I give out the numbers, before you see the numbers on our Facebook platform, please call 5100. 5100, that's the AGO number, 5100. Follow the voice prompt and do whatever you have to do, and then get linked to the health worker at the end of it all. If you don't want to, you also have the option of calling the call center directly, the Savannah Signature Sexual Health Education Plus. It doesn't mean we teach you about sex here, no. It's just a call center manned by some health professionals who are there to take care of your needs 24/7. Just like Mr. Akwa said, if you need referrals and they think that they cannot handle you at their point, yes, we refer you. So we can easily refer you to these gentlemen and other psychologists around the length and breadth of Ghana to take care of your needs. You can call the She Plus call center on 0544 711 799, 0544 711 799. Once again, it is schools are closed, but it is not a holiday on Safsan TV. These are special editions we are doing from today till Saturday. We will top everything off on Saturday with a bigger studio audience or guest. Be with us tomorrow. One very interesting thing that I will be talking about tomorrow is postpartum depression. I think this is one of the major issues about maternal health that we do not deal with adequately. Tomorrow we have people in the studio, resource people. We have a psychologist, clinical ones, in the studio with us to throw more light on this subject for us. Take care of yourself. Self-care. It has to be a conscious thing. You don't just get up and start doing it. No. We've talked about making a plan. Please, it is necessary. If you need help to do the plan, please call the platform. We will link you up with a psychologist, and then they will help you through it. One thing I'm also taking away is counting your blessings.
Yeah.
Counting your blessings.
Don't be too hard on yourself.
Don't be too hard on yourself. I nearly said something. Things happen. That's just how I'll leave it. Things happen. So please count your blessings. Find something spiritual and indulge yourself in. We don't mean you should go and be shouting in some corner. If shouting is what helps you, find you can. But I mean, find something that you can easily link to get that kind of relief, that kind of, you understand. Please take care of yourselves. We'll see you tomorrow, same time, 10 a.m. here on Southside TV. Please, self is paramount. Thank you.
Thank you very much.